Hi, everybody, and welcome to the final panel on day 2 of the conference itself. So clinical QA all day is coming to an end after the session. Very sad because we're having a lot of fun, a lot of great engagement and questions that were coming in. People seem to be really loving the content that has been coming out and being able to touch base with experts in the field. So we are absolutely loving that. And thank you guys for the engagement. And thank you for the panelists for joining us today. So I thought we would get things started with a little icebreaker question. So my question to the audience today is, if you were to win a big jackpot of the lottery, what is the first thing that you would spend it on? Or what is the first thing that you would do with it? So please, in the chat, guys, please answer the question and just put in what would you spend your jackpot on. So I'm going to ask the panelists here, is there what would you guys do if you won the lottery and what would you spend it on?
I can go first. It's getting to be wintertime, at least around here, and I'm a big skier. So probably the first thing I do is book some little condo or something right off of a ski slope and go have a week doing that and clear my mind.
Clear your mind. I like that. That's really good. And how long would you be staying there for? What are we talking about? Is it a few days? Is it
How much money do we have, Kim?
Okay, that's a good question. Let's see what we could do. Let's say it was about $50 million.
Oh, wow.
Oh, okay. Well, then probably most of the season. Yeah, eventually there won't be any snow anymore. I don't think 50 million snow come. Yeah.
Okay. Well, if you want snow, you can go where there's snow year round. You could go to Antarctica.
Yeah.
Do that, and then just do that. Paul had mentioned that he would go there. There's penguins there, so that's kind of cool. Just saying that maybe.
On my list.
It's on your list. A lot of people are saying travel. Absolutely. And some people saying being responsible, paying off debt. I think that's also good. Take care of the debt, and then you can enjoy the rest of the millions. So that's really good. Loving that. Loving the engagement. Danik, you would buy so many carrots. Yeah. Thank you, Danik, for buying so many carrots. That is awesome.
Kim, you said go on a trip in the sun. I read that as go on a trip to the sun, and I didn't know how.
Somewhere I should have said somewhere sunny. Imagine I just take a trip in a shuttle just going into the sun. Yeah. It's goodbye world. It's done. So, well, thank you guys for indulging in our last icebreaker question. Now we're going to move on to some housekeeping rules, just so that you know. Session's going to be recorded. All the sessions are going to be recorded and made available to you at the end of the conference. So don't worry if you miss anything. We will have it on demand and you can watch it back and play it at your leisure. Just so that you know, a certificate of attendance is going to be provided at the end of the conference. So you can share it on LinkedIn and let everyone know about the wonderful online clinical QAI all day conference that you attended and everything that you've learned. And you can brag and boast with your colleagues and friends. So be on the lookout for that after the conference. And just so that you know, this is an interactive session. So please get your questions in to the chat section on the right side of your screen. You'll see a panel, engagement panel, where there's the chat and the Q&A section. So please submit your questions. You have some experts that are here, that are in the field. Now's your chance to pick their brains and get some much needed answers to your questions. And lastly, on the housekeeping agenda, so some of you have been asking about what Montreal offers, and if you're interested in learning about our ETMF and EQMS and RIM technology, or how we can support you on being inspection ready, simply click on the button above the screen. It says book a demo, and we'll be happy to reach out to you and answer any questions. And just so that you know, if you haven't been in the other sessions before, just want to let you know that we have a survey that is going out. We're collecting some data about what is going on in the QA space, clinical QA, and AI. So we want to get as much information in the from you guys to get an insight of what's going on in the industry. So if you fill out the survey, you're automatically put into a draw to win these wonderful, one-of-a-kind QA all-day Converse kicks that are going to turn heads and make you the talk of the town. So make sure to fill out the survey, and you could possibly win big. And for la pièce de résistance, I'm going to be introducing the next session, the AI-ready QA leader, balancing innovation and quality assurance. So I'm going to hand it over to you guys. Have a great session, and see you later. Bye.
Great, thank you, Kim. So we've already heard a lot about AI over the last 2 days, and I think that this is really the session where we're going to start to get a little bit of insights in terms of what QA leaders are thinking in relation to AI. How do we sort of make sure that as the organization starts to implement solutions that are AI based, that we can properly manage them and ensure that they're being used responsibly. So I'm joined by some very experienced panelists today. First up, we have Brian Barnes from BioNTech. So Brian is the Director of Risk Management Strategy at BioNTech, and he's got over 20 years experience across sponsor, vendor, and technology spaces. So he's really been on all sides of the table. Brian focuses on implementing risk proportionate approaches and strengthening sponsor oversight in clinical operations. His work advances process excellence through data-driven strategies, centralized monitoring, and AI-enabled oversight, supporting quality and efficiency across global programs. So thank you for joining us today, Brian. Next up, we have Aaron Grant from Just in Time GCP. Aaron is Head of Innovation, and he leads the integration of advanced technologies to enhance clinical operations and ensure GCP compliance. Aaron's got over 20 years of experience in regulatory and clinical research technology. He's focused on delivering practical, usable solutions that delight users and improve business processes. Aaron is a regular contributor to the CDISC TMF reference model, also now known as the TMF standard model, and is helping to shape the technical direction of the TMF industry, including EMS, DDF, and V4, which is now known as V1. And so welcome, Aaron, to the panel. We also are joined by Dr. Paul Palmer, who is a seasoned pharmaceutical consultant and qualified person with nearly 4 decades in pharmaceutical manufacturing and supply. So Paul founded Paul R. Palmer Limited and the Academy of Pharmaceutical Excellence, and he specializes in regulatory compliance, quality systems, and inspection readiness. Paul is renowned for transforming complex GMP principles into pragmatic inspection-ready solutions. So we're really great to have you on board, Paul. Obviously, you're bringing a lot of experience to the table from lots of different angles. So I'm really interested to hear what you have to say today. And then finally, we have Matthew Scotney from CEPI. So Matthew is head of GXP quality and compliance, and he's driving global vaccine development and pandemic preparedness through robust quality systems and regulatory alignment. He's got 25 plus years in biopharma and advanced therapies, including computer systems validation and quality risk management across multiple GXP environments, such as clinical research and GMP manufacturing. So great to have you with us also, Matthew. So with that, let's maybe get started. So I did prepare a few questions for our panelists today. And also to the audience, if you have questions as we start to have our discussion, please post them into the Q&A panel, and I will be monitoring that, and I'll try and bring those questions to the panelists so that they can answer them for you. So I'm going to start really just talking about the role of quality assurance. So how is the role of quality assurance evolving as AI becomes more integrated into clinical research? And what new competencies do QA leaders need to develop? So I'm going to put it out there. Who would like to give us some insight in terms of how they see the role of QA evolving?
I see it as less involved than it is in the moment in the doing. More oversight, audits, and monitoring, trend analysis, identifying issues as they happen, or even predicting change, and a lot more focus on the suppliers, because the way that the AI suppliers are set up in the first place, the way that the applications are trained, has a massive impact on how they operate within the business.
Right.
There's going to be a lot of people that they don't necessarily need to change the way that they approach things completely, but they need to understand that the standard approach to quality assurance that they've always used is not going to be the same anymore. They need to look deeper into the not just the validation, but the actual design, as well as the qualification, before they actually use these things.
Yeah,
right.
I agree, Paul. I mean, like one area, because I'm kind of more on the provider side, that I look at is, I think our tools that we've developed in QA for a long time to, assess different types of software and how we use it and how we use those things in our systems. I think it is going to have to adapt a fair amount, right? Because these systems don't work in the same way of traditional computer system validation, right? CSV tools don't really work where you have, the possibility of hallucinations in the tool and things like that. Mm-hmm. And some companies are going to, kind of take a very cautious approach to that. But, you have a lot of vendors that are a lot of, partners that are going to potentially start using this technology. So I think it plays into how do you bring it into your own company, and then how do you provide oversight when your partners are using technologies like that, and how do you understand them and make sure that you have proper understanding and control over those things.
And I think it's very interesting when you look at it as a QA leader, what Paul and Aaron have both said, it is so important. As a leader in quality, you can't bury your head in the sand and say, I don't understand this. I don't really want to think about it. It's so important that we're ahead of the curve and we start asking the questions. I think when we had our discussion earlier, a couple of weeks ago, talking about sort of thoughts and processes around the questions, we were discussing that need to speak the same language, ultimately with all of the people we're interacting in, whether it's our own organizations, whether it's external organizations and vendors. We need to understand what people are saying so we can ask the right questions in that sense. And then, of course, if we can do that, we can then mentor the rest of the quality assurance teams as well. Quality assurance is inherently cautious, and therefore sort of trying to bring them forward into AI, I think, is going to be an interesting challenge. And as leaders, that's where we have to take that lead. We have to grab the bull by the horn, so to speak, and actually make a real significant effort in trying to understand what's going on. And Aaron, you talked about qualification and the tools, not throwing the baby out with the bathwater in that sense. So we have these tools. Yes, they may not be directly relevant, but we can still apply them. We can still use our quality risk management principles, etc.
Mm-hmm.
And I think for me, one of the biggest conversation parts, and maybe we talked about a little bit here, is terminology. And I think the first is AI is a big bucket, right? So it can mean a lot of different things. And for me, as we've started to think about it, is taking a risk-based approach to the implementation. So the use of AI, there's different forms, and one of the big kind of decision tree kind of risk-based conversations that I go through is kind of the outcomes that are coming there. There's deterministic and non-deterministic. And I think that really makes a huge impact on the QA involvement and the oversight that's there, right? So for me, I kind of see that evolution and where I kind of come back to the principles in ICH GCP is a risk-based approach and risk proportionality, is we shouldn't take a one-size-fits-all approach to AI in general. So maybe we dive more into that as the day goes on, but I think there's going to be a lot of terminology separation that needs to be taken into consideration.
And I think also understanding how people are using it, what is and sort of tying it into your overall sort of study risk assessment. So if we're using AI in areas where inherently we're dealing with high risk processes, and then also, the degree that we have human in the loop should also kind of dictate the amount of oversight I think that QA has on it, but also I think coming up with what's responsible use, what's acceptable use of AI, and giving that kind of guidance, because I think that people can get really excited about this stuff, right? And they can get carried away because it seems like it can do so much, but having that proper kind of framework in place and tying that into the bigger sort of risk-based picture, I think really important. So have you guys already sort of started to think about that, the frameworks, and how we kind of take the lead as QA leaders for implementing these kinds of policies and frameworks for acceptable and reasonable use, and sort of making sure that it integrates with everything else?
I think a lot of the time the suppliers are already providing us with AI services, whether it's AI, whether it's agentic, whether it's machine learning, whichever variant. I think a lot of companies are utilizing AI before they even realize. And I think what we're doing at the moment is catching up. Working on one of the key areas that I found is often not necessarily ignored, but not realized, is the public versus the private AI platform. And not realizing that your trial data is getting shared publicly because you've not set it up correctly. And I think people are on the back foot. I wouldn't necessarily say it's the senior management. I would say it's the trial coordinators, it's the quality assurance that are realizing that things aren't going the way they're supposed to, that they've been set up wrong in the first place, and they're having to backtrack and fix it.
Yeah.
And then set up the policies that you're talking about.
In the previous session, there was some discussion around companies sort of setting up AI compliance committees, or sort of groups that are really just looking at the use of AI across the organization. Have you come up against that? Have you seen that, or does that exist in your organization?
I think one of the big pieces in conversations that I've had is how do you augment activities, right? And I think that's kind of the piece that's there for me. And I think a big piece is, kind of going back to the term deterministic and non-deterministic. So when you kind of look at some of the recent regulatory guidances, is, for me, one of the key interests is in the non-deterministic, right? So data that wouldn't be available for submission or anything that's going to be used in that space. And I think there's a lot of efficiency gains and quality gains that we can get with using AI in those fashions. So in that non-deterministic, there isn't a right and wrong answer. And I think that, to me, is kind of the exciting part of, as people kind of think of, what is jobs going to look like in the future, is we talk about the human in the loop, but I think the importance of the subject matter expert and that experience level as an augmented to your workflow is becoming more and more important, right? And so I think that's where the training is very important, and the change management and the processes that you are building to support it. So, and I think maybe the other point to Dr. Parma's response is, I think we'll always be catching up, and we've always seen that in technology where you can't wait for the right answer, right? Technology and the speed of the innovation of the AI is coming so quick. We will always be playing a catch-up game, and for me, that's okay as long as you have the right training, kind of human in the loop capabilities there. I think that's kind of the new normal that we have to work through. So there'll never be the right time to start, more so than now, right? And moving forward.
And I think interestingly, sorry. Thank you. I joined the previous session. I think one of the comments that was made, which is, to my mind, a really good starting point in the governance process, is why are we using AI? What is that? There may be some value in it, but actually, do we really need to be using AI in this particular instance? So it's a clear understanding of why we're developing the tools, what they're going to be doing, and then what the risk is associated with those tools as well. And if we can put that as our starting point, then I think it becomes a lot easier then to look at the quality requirements and the compliance requirements associated with it.
Yeah, I've seen certain companies start to set up different types of governance around this stuff. I've seen companies have an AI panel that is more risk focused. I've seen budgets get put in place where, like they want to run some experiments with some key areas. I think, to somebody's point earlier, it's really important that you start to gain some understanding about just like the layers down from just AI as a concept overall. We talked about deterministic, non-deterministic, there's machine learning, there's large language models, there's other pieces like that. It's important that when you're looking and trying to figure out risk models, that you understand these technologies. You have groups within your companies that are developing the skills to understand these technologies, because they're going to have completely different risk profiles based off what's going on. Some are going to have data concerns. Some are going to have more decision concerns. You need to, start building that capability, as we're moving along, to build that in. And whether that's you or you set things up within your company that you find the people that are more interested in that to start, building that evaluative knowledge. Because to Paul, to your point, I think people get super excited about this technology, and they should, but it's very quickly, my experience, you get 85% of the way there in a week, and somebody wants to go crazy with a project only to find to get that like extra 15% to make it usable can take you months, if not longer. And that's where also, your providers are going to be able to give you a nice demo or things like that. But how do you evaluate, do they actually have something real for you? Because I think, I see a lot of projects right now. I think there was the MIT or somebody released like a project that 80 or 90% of AI pilots are failing right now. And I think we're in like kind of this early stage where it's going to become really important that you find, people within your organization and other partners to the subject matter expertise we talked about before. These things have lots of capabilities, but they don't have the subject matter expertise built in. Are you providing that to a company to build out their products, or are they bringing that also to the table in how you kind of, build things out, so you don't have a 6-month project till you actually realize any value from it?
Yeah. I think also, so something that Paul sort of started with, and that was kind of understanding, where your data is, how it's being used with these different third parties, is also really important. And I think that it's not always that clear. I also think that we have to sort of understand, for example, are these third parties training their AI using all of their different clients' data together, or is it segregated? All these kinds of things. So, auditing an AI vendor is going to be slightly different to auditing a traditional software vendor, I think. And so, have you guys already sort of started to think about that and sort of come up with sort of criteria by which we should audit, or are you working with maybe specialized auditors who have the knowledge to be able to go and evaluate these vendors? How are you approaching that?
It's one that I'm doing at the moment. It's a standard Microsoft off-the-shelf model. And the first thing we've done is look at how to maintain the data internal rather than having it shared externally. And we've unfortunately got both options set up. So we're having to train individuals to know that they're using the right one, because the public version comes by default, and the private version you have to go and find it. And I go and do the audits myself at the moment. I've been, I suppose, working on looking at how to audit the data supply and the way that we manage the introduction of digital systems for, I can't think how many years at the moment. I think my first tech audit was back in early 90s, mid 90s maybe. But it's changed so much. You used to be able to just go in and make sure that they've got their backups that are actually set up properly, that they're actually verifying that they restore. Now you have to go into the coding You have to go and look at, are they actually using the data the way that you want them to use it? Is the actual product that's being offered fit for purpose? Does it meet your URS? And a lot of the times people are designing URSs and they don't know what they mean when they're even designing them. So trying to audit against an inadequate standard, I suppose, is probably the best way to put it. So I always make sure that I'm involved in the initial, most of the time, involved in the initial setup so that they actually understand, and I give them a training so that they know what they're talking about right up front. Because most people that I've met, I would say the odd one or two, don't know the difference between deterministic and probabilistic, and they just go for the public knowledge and go straight for probabilistic, and they don't even realize that there is a deterministic option.
Right. So it's a challenge. How about everyone else? Have you undergone audits, or have you performed audits on these AI solutions?
We've been getting a lot of questions, right? Because I'm kind of more on the provider side. We haven't gone through, well, we've done internal audits, kind of looking at different regulations just to get ourselves ready for when people eventually come in. We've been getting a lot of questions. And most of the questions, I mean, the first layer of questions, I think, is pretty easy for most people to ask because we already have a lot of these, which are more data questions, let's say.
Right.
I mean, a lot of these tools, the way they're structured right now, it's tough to provide a service and keep the data internally. So there's a lot of questions just like, how are you getting my data? What are you doing with it? How long are you keeping it for? How are you destroying it? Those kind of things. What are you doing with it? Where does it live while it's there? Those kind of questions, I think we have good frameworks to be asking those. And I think that's a good starting point of what you're asking for. And then the questions from there start going maybe up the level of, that are sort of the newer questions you want to be asking is how is this AI making decisions? How much, how easily can you explain to me the process that it's going through? How clearly do you have oversight, provider, over what it's doing? So like, do you have a human in the loop? What's your oversight process? How are you keeping track yourself that this thing's going in there? And there's interesting frameworks that have started to be published. There's the FDA's credibility assessment draft white paper. Annex 22 for the EMA is a little bit different, but has some information in there. So those are good starting points to think about how the regulators are thinking about these things. And I think it's useful for us to look at these and, how, and a lot of them lay out very nice frameworks for how you can kind of assess how some of those decisions are being made and different pieces to the puzzle.
And I think building on that from a quality and a quality background, as a quality auditor, we can go in and we can do assessments of organizations. We can do standard vendor assessment processes. But when it comes down to critical systems, so if you truly identify the system as being critical, I think I could do exactly what Aaron suggested. I could go in and ask the basic questions. I could get a feel for whether I'm willing to trust the organization. And if that bit goes horribly wrong, then that's not in a good place. But if I assume I trust the organization and they seem reasonable, if it's critical, I think at that point we would still need to be bringing experts in software design, AI software design, etc., because I am not going to have the toolkit necessarily to start with. But then hopefully over a period of time, we can learn as quality organizations, as quality professionals, we can start learning what the right questions are to ask, and then what the expected answers are.
Yeah.
One other quick point, just to point out around data is, like, we've been asked, can you tell us the data that you're pulling? What's the risk around that data? And, how does it sort of influence everything else? I think that's helpful to lean on your providers sometimes to help you communicate up the line too, and help the rest of the quality organization understand, okay, this thing is absolutely critical to the pathway, right? This is how we're making decisions about whether this drug is working or not, versus this is more administrative or operational or things like that. That, if we do get a 97% accuracy, or we do, or if some of this data were for some reason to leak out, the risk is lower, and that they can help you kind of identify that and help you quantify that a little bit better. So you don't have to do that all yourself.
Yeah, and I think that really needs to feed into the study risk assessment you're doing as well, right? If you're using tools to manage critical to quality processes or high risk processes, well, you need to lean on your vendors a little bit to give you that sort of foundational knowledge that you need to then integrate it into your risk assessment. So it's there's definitely a very close relationship that's required, I think, between the vendor and the sponsor when it comes to that. I want to talk a little bit about how you sort of monitor this. So, how can QA teams proactively identify and mitigate risks introduced by AI, such as algorithmic bias, data drift, or lack of explainability before they impact trial integrity? So how are you looking at the outputs and how are you monitoring that over time? Because obviously, if we're, quite often you're retraining or you're continuously training AI agents or algorithms. So how are you sort of monitoring to make sure that you can rely on the output?
For me, it needs to be a human in the loop. You have to have continuous understanding, but not in the same way that we have historically. You don't have to just continuously trend. You have to have a means to see what's changing and why. It's like with a standard program, ERP or whatever. You want to see that you want to lock it down and then only introduce a new change when you validate. Well, you can't now. You can't with AI. You can't with probabilistic in particular. It's going to change from one request to the next. So you have to identify the strategy that you're going to use to verify that it's actually realistic what you're doing. And a lot of the time, for me, it's well, that doesn't seem to fit right. It's like when I walk into a warehouse where the stock is stored, or where I walk into a clinical environment, I look and somehow you get drawn to the thing that stands out from everything else that's different. And I find the same with when you're looking at the data that's produced by AI, you can see something's changed. But the problem I have is I can't explain why I know.
I mean, for me, what's been helpful through the process as we kind of come into it is, in dealing at least with the probabilistic or non-deterministic type AI things like a large language models or ChatGPT or things like that is, it's been useful for me to develop this kind of like knee-jerk reaction of thinking about the fact that we've actually solved a lot of these problems dealing with parts of a process that don't all work reliably and don't always do what they're supposed to do all the time. When we look, actually, even before computers, we've been dealing with people for a long time. It actually very similar to these new technologies. So it doesn't mean that they're exactly the same and it's a drop-in, but a lot of the processes that we put in place to manage people's, natural error rate, I think apply a lot of times to some of these new agentic technologies. So, having QC, having layers of, oversight that go into that, making sure things are trained the right way, documenting what you're doing to train these things. A lot of those policies actually pull along a little bit into these things about how you can get a process that you have confidence in, given that there's actors in the process that are unreliable. So I'll just pass that along. That's helpful in how I think about these things a lot of the time.
Yeah, Brian, I know you have something you want to say.
Yeah, no, thank you. And I think both those are really important. And the piece that I like there, and for me, what really got my interest very early in kind of the AI space was in the risk assessment. And for me, there's often a lot of times the hesitation or there's the hallucinations that are going on. And I think what's really interesting of that is that a bad thing? And that's where, you kind of look at some of the trends that are developing. And as I start to do risk assessments with my teams, it's actually unlocking things, patterns and recognitions, things that we hadn't really thought about before. And I think that's the most powerful impact. So, being able to kind of accept it and say, yes, it's different, it's not wrong. And then having the right subject matter experts in the group or in the room to go through those and review those and have that quality discussion is key, right? So it's not automatically saying, hey, this is a hallucination, this is bad, but have we just not thought of it in that other way before? And so for me, that's where, and I like, Aaron, what you said is keeping with a lot of the same processes that we have in place, because to me, a lot of the AI is just acting like teams have always acted, right? If I do a risk assessment with one team, I don't get the exact same risk assessment across teams, and that has been standard. So you develop kind of mechanisms of oversight to put in place to support that, and to kind of support the kind of radical thinking and diversity of outputs that you're getting now. So that's kind of where I come back to the idea of build that into the process, and accept that variability as part of it, and celebrate it. I think that's kind of the exciting component to it.
No, I agree. I want to switch gears a little bit. We've spoken a lot about sort of the governance and compliance aspect, and the risk-based approach to AI. I want to talk about how, as QA, we can start to leverage AI to help us do our job. Help us do our day-to-day, and how can we sort of utilize AI to help us move from this kind of reactive issue detection and then sort of reactive correction mode to more of a proactive oversight mode, where we're getting signals, we're leveraging AI to give us insights to things that may not yet be a problem but could become a problem, for example. So any sort of thoughts or any things that you're already doing to leverage AI in your day-to-day to help you be a more proactive QA leader?
Okay, go ahead, Paul.
I use it every day for data analysis, for collation, for presenting it. But at the moment, I'm looking at agentic AI to be a bit more proactive about it, to actually utilize an interface that will give me insights into what's happening now.
Yeah.
I am finding that the training of it's a bit more complicated, and making sure that you've actually got some guardrails in there is, before you really know what it's going to do, is quite challenging.
Yeah. No, I think, definitely using it to actually evaluate compliance, and get a pulse of what's going on is for me, it seems like a no-brainer. But the challenge is standardization of information, right? Brian, you were going to say something. Yeah.
Yeah, I think for me, and this is kind of the piece that I'm interested in most about AI, is bringing it along as a teammate, as a partner, right? So for me, it is Brian and his model, right? And I don't want to say it's the model, but it's that collaboration piece. So for me, it's a part of everything that you do all day, and I think that's part of what I'm excited about is part of AI. And I think where we actually build a lot more quality into systems is it is a partner that sits next to you in every meeting and every email and every thought, is having that conversation. And I think that's the other piece that I've been working with, and how do you increase adoption and change management, is thinking of it as a conversation. It's not I'm going to put there and I take everything that it gives back to me and I move forward, but it's a critical thinking component. So I share something and it's a conversation back and forth, and that's where I think we get a lot more quality. And for me, the better that we're able to teach the knowledge worker today to have that conversation with AI, I think that's where we actually start to see the quality and the efficiency gains that we've been striving for years in clinical trial development. I think that's where we start to unlock those pieces. So how do you teach the knowledge worker today to have those quality conversations with AI, to leverage your expertise as a subject matter with its large language model capabilities, and that combination? That's the part that's really interesting to me right now.
I'll share one funny anecdote. I was at another quality conference about 2 months ago. And we were talking about just large, kind of ChatGPT based technologies. And it was a bunch of quality people sitting in the room. And they were all out of one side of their mouth talking about, you can't use this for anywhere in the organization. It's so risky. It hallucinates things. It does all these stuff. And then somebody brought up, I use it to write SOPs a little bit, or at least to help me write SOPs. And almost everybody was like, oh, yeah, I use it for that. I use it for that. Yeah. And then it was just like, it's out of both sides. I found it so funny that everyone's like, oh, the organization can't handle that at all, but we're responsible enough to handle that. And that kind of juxtaposition, I think, will play out throughout the organization as we go. But obviously, I think some people are using it to write SOPs.
Yeah. Matthew, any thoughts?
I think, sorry, what Aaron was saying was quite entertaining. I mean, using it for writing documents, pulling information together, writing summaries, fantastic. But ultimately, you have a human in the loop there, which is that critical factor, isn't it? We use it in meeting minutes. You can use it as your governance process, so it generates the meeting minutes of your governance. That could then be presented to a regulator. That's fantastic, but you always have somebody signing off on it. I think that human in the loop becomes absolutely critical. We talked already about the risk-based approach, and I think where I can see significant benefits is where it's the analysis of data in that particular instance. So you have a data set, you have a controlled pool of information that you're asking the AI model to actually look at. Obviously, you need to know the training of the model, etc. But the model itself is then a fixed model that you then apply to data sets, and that could be used in stability studies, ad specification investigations. From a manufacturing point of view, there's many areas where you could potentially use it. But I think from a clinical point of view, again, similarly looking at some of the monitoring of clinical data, is that an outlier? Are you in the situation where your temperature data appears to be incorrect or inconsistent and could then be detecting things like fabrication of data, etc., or at least flagging data sets which look unusual, and then the human would investigate?
Yeah, no, absolutely. I think one thing that we work a lot in the TMF space, and I know that Aaron does as well. And one thing that we've always been very frustrated with when it comes to TMF is that everything is kind of in documents, and it's all very kind of unstructured for the most part, and it's kind of like a gold mine of information that we could never really mine properly. And all of a sudden, AI is kind of changing that. It's starting to open up that gold mine, and some of the things that we're sort of thinking about is can we evaluate study plans, read all the SOPs that are relevant to the study, read the protocol, read the clinical study report, etc., and start to understand, well, what are the processes that we should be seeing in this trial? What is the expected evidence? What should that evidence contain? And then what's the relationship between those things? And really start to evaluate compliance on an ongoing basis based on what we're starting to see within the TMF, within the CTMS, and actually all of the other Connex systems. So I think for QA, there's actually a really interesting opportunity here to be able to start to implement agents that can do almost real-time compliance monitoring to start to trend, but also to start to highlight things that are occurring that maybe you're not aware of. No one submitted a deviation, but it's quite obvious that there's a protocol deviation that's occurred. Or there's a deviation to the plan. So I think that's just one example where I think AI is definitely something that could be extremely powerful for quality oversight.
Yeah,
and I think,
oh, sorry, Brian, go.
I was just going to say, I think for me, that's one of the best use cases, if you want to call it a use case. For me, when you look at increasing quality and efficiency, is I think historically we've been limited by kind of the disparate data systems, right? We've had to align them and bring them together, but now we don't have that kind of limitation any longer. And so for me, I can now combine disparate data sources together and then do that very quickly. And so historically, kind of things that we wouldn't have brought into that process to support an oversight, we're able to now to bring in because it can literally be done in seconds, right? And so that to me is what changes the way that we've historically thought about quality and quality oversight, is not to have those rate limiters anymore, right? But rate limiting in terms of data alignment and speed, right? So that's kind of the oversight mechanisms that you put in place now change, right? What does that look like now? And it will continue to change as the models get better, this week and next week. What we do now will be different next week, right? And so that to me is the exciting thought, is to think about the principles behind it and not the actual technical system components right now.
Yeah, I think one place that's like really interesting is around that oversight and the possibilities there. If you think about it, there's a lot of times, let's say, you're a sponsor dealing with a CRO, they have a lot of processes in place that might keep things in line, right? If you have a protocol deviation, making sure things go the right way. But as a sponsor, you don't always have clear view. You don't have a clear view into all of that, right? A lot of times all you get might be the TMF or access to TMF or things like that. And you might not get direct access to their CTMS to see the process of how they're following up on monitoring or something like that, right? But you get the TMF, you can almost reconstruct some of that data now, potentially with some of these tools, being able to have oversight in a way that would be impossible before, right? Reading hundreds of monitoring visit reports or things like that. It then creates an interesting downstream issue for you, because now you run the risk of getting so much data in that now you're overloading yourself in how you process that through. But let's get to stage one, and then we'll figure out stage two. Probably AI can solve both of those problems. Right. Yeah. AI and risk. Great. Yeah. Just throw that at everything. But I think those are interesting problems. And it goes the other way too. I mean, we have evidence now that the regulators are starting to use that. I was talking to somebody the other day who was going through, it wasn't an inspection, but kind of one of those remote assessments that the FDA does. And it was pretty clear they were using the ELSA, initiative that's their large language model, I think from Anthropic, that they're using. And they asked for a bunch of records, basically going in, and they came back and said, here's a bunch of things that we found in these records. So you're going to get that from the other side too, even if you're not adopting it internally. So you kind of have to think about it from both sides.
Yeah. Guys, we are getting very close to the end of our time, and there is a question from the audience that I think is a really interesting question. So I think we're going to finish up with that question. So the question is from Rashana. So what, according to you, are the top 4 elements that should be considered in your AI playbook from a clinical trials QA perspective? So what are the 4 things you really should be thinking about as QA when it comes to AI? One each. You've got one each. There's 4 panelists.
Can I take the easy one? I'll say, we touched on it a bunch, and we had a lot of conversation about it, is a risk management framework, or a risk framework for when you evaluate different projects. And it can be multi-dimensional, right? What kind of AI technology is being used, what data is being used, what processes and decisions are being made out of that, to help you better identify, is this, how much oversight do we need to have over that? I think that's really important to every organization.
Okay, the risk framework. Okay, good. That's one.
Sorry, too long.
4. What do you think?
So mine's going to be a digital twin, so that you can actually run your trial protocols, practice them, and identify the gaps or the omissions, or use AI to actually improve the protocol before you even start.
Nice one. All right. Who wants to go next? Brian or Matthew?
I think Aaron stole mine. Risk proportionality is my favorite word, so I'm gonna have to swing. And really, I think the other one I'll take is, and I don't want to say change management, but I think the historical way that we've approached technology change management won't work with AI for a number of different reasons. So I think understanding what change management is going to look like and user training is going to be a key part.
Good one. Absolutely, I agree. Matthew, you're in the tough spot. Do you have a fourth one?
I do, and it's a slightly different approach. I think be clear on what the AI is going to be used for, what you want it to be doing, and be very clear on how you're going to demonstrate to your quality organization, to the regulators, that it's doing what it's supposed to be doing.
Yeah, good one. Okay, that was amazing. Thank you to all of you for giving your insights and knowledge and experience. There's obviously a lot to think about when it comes to AI, and I think that there's a lot of promise for being able to leverage AI to implement much more proactive quality management and quality oversight within our clinical trials. But we need to make sure that we're checking the boxes when it comes to compliance as well. So thank you all for your time and giving us those insights.